Lions Eye Institute for Transplant and Research has become the largest combined eye bank and ocular research center in the United States. As a nonprofit organization, the Lions Eye Institute has worked to develop ocular tissue processing and delivery techniques with the objective of easing cornea transplant procedures and improving clinical outcomes. Lions Eye Institute for Transplant and Research processes and distributes over 10,000 corneas annually out of a single facility. Using unique tissue dissection techniques, the Lions Eye Institute prepares nearly 75 corneas for endothelial keratoplasty every week. Approximately 50% of our EK prepared corneas are preloaded at the request of surgeons to their specifications. Lions Eye Institute for Transplant and Research offers a very simple, single-use delivery system, preloaded with ultra-thin DSAEK tissue that is pre-dissected, pre-stained, pre-marked, pre-punched, and preloaded to the surgeon's specifications. The components of this system include an end cap connector, 14 French tubing, a 2.8 millimeter Weiss glass ophthalmic cannula, and permeable sponge inserted in the tip to secure the graft during transport while still allowing the exchange of cornea preservative. I use forceps to remove the TransplantREADY system from the transport vial and place it into a basin or petri dish filled with BSS. I attach a 5 ml Lure-Lock syringe filled with BSS to the end cap connector and protect the graft from ejecting by submerging the tip of the cannula with the sponge inserted against the side of the basin. Firmly hold the preloaded system so the syringe can be slowly pushed through the valve, then twist to secure the syringe. If you choose to exchange the preservative solution with BSS, again, submerge the tip of the cannula with the sponge and hold it against the side of the basin. Slowly and gently infuse BSS to replace the preservative. Once free of preservative, simply remove the sponge while the tip is submerged to avoid getting air bubbles in the glass cannula. DSAEK tissue is loaded into the 2.8 millimeter Weiss ophthalmic cannula with the endothelium side in. Mobilize the graft before insertion with a reverse Sinskey hook by advancing the tissue to the proximal end of the bevel. Position the glass cannula bevel up in the anterior chamber prior to and during the injection to ensure the correct orientation. The tissue is now ready for insertion. I use a 3.2 millimeter incision for DSAEK. Because the DSAEK tissue is oriented with endothelium facing down when the bevel is facing up, orientation of the graft is assured. Preloaded corneas prepared for DSAEK procedures have been successfully transplanted in countries around the globe. Transplant-ready preloaded DSAEK corneal tissue from Lions Eye Institute for Transplant and Research using the 2.8 millimeter Weiss ophthalmic glass cannula allows for a gentle, controlled delivery of DSAEK grafts into the anterior chamber with minimal endothelial cell loss and a no-touch fluid injection procedure with no AC maintainer required.